Well, in the US, we haven't had many options. In the past, one of the things that had been looked at is bone marrow transplant. That's, of course, a risky treatment. And the long-term outcomes are still under research. Now there is an enzyme replacement therapy to give back the enzyme. That's been more recently approved in the US. It's been approved in Europe prior to that. And the hope is to slow progression of the disease. But again, we really need long-term outcome studies to see what the full effect of that treatment will be. Because we didn't have a lot of very effective specific treatments, we had not been seeing patients very often, maybe every few years, to make sure that they have gotten to the subspecialists that they need, that if they have any new disease manifestations, that we get those addressed appropriately. Obviously, physical exam and history are most important, so we can identify those new complications that an individual may be experiencing, and get them to the right subspecialist to evaluate that for treatment. Certainly, functional tests later on, things like 6-minute walk or 3-minute stair climbing tests, pulmonary function tests, can be used to assess their functional status. Evaluations by physical therapists for functional abilities. Hearing exams serially are important. As soon as they're diagnosed, we expect most patients will develop hearing loss, so identifying early so that they can get appropriate therapies and adjust their learning plans. Other management that we do is of course routine blood tests, checking routine chemistries and blood counts. We check their oligosaccharide levels, and on their initial diagnosis, we'll often check their enzyme activity, just so we have a record of it. Of course, their primary care doctor is very important for guiding care. Generally, genetics is involved to do testing, disease education, follow-up testing of family members. We see ENT involved because of the hearing loss, audiology. As these patients develop orthopedic issues, we see them seeing orthopedics, physical therapy, occupational therapy, physical medicine and rehabilitation. Physicians, of course, ophthalmology for the eye concerns, neurology, as these patients do develop ataxia many times, as well as a myopathy that causes progressive weakness. The tip of the iceberg of what can occur. We see all of many other manifestations, including endocrine disorders, so endocrinology, pulmonary issues, so pulmonology, sleep medicine may be involved.